If you've got lower back pain and you're worried about leaning forwards, maybe it was a cause of your symptoms to start with, or maybe you've been told you've got something like a disc herniation and that by leaning forwards, you're only going to make it worse. It's a very common concern with people with lower back pain. But unfortunately, if you don't start leaning forwards again, which we call lumbar flexion, your back pain is either not going to get any better or it's going to take a long time. So here's 2 simple ways to start reintroducing lumbar flexion in a way that feels safe to you and hopefully doesn't cause you too much pain. To start, you can perform a seated lumbar flexion variation. And to do that, sit yourself down, place your hands on your lap, and then slowly start leaning forwards. As you lean forwards, you should feel pressure going through your hands, which in turn is just offloading your lower back slightly. Only go as far as you feel comfortable, and remember to breathe as you're going through the motion. This just relaxes some of those muscles. You can repeat this up to 10 repetitions and try it a few times a day. If that starts to feel quite easy, you can try a standing variation. And to do that, find yourself a blank wall, lean your butt and your back against the wall, place your feet about a foot further forward, and then lean forwards, and repeat 10 times a few times a day. And you can always swap between the 2 exercises. And finally, when your lower back starts to accept this position again, reintroduce something like a deadlift. And you don't have to use anything heavy like a barbell, simply placing a weight on the floor or using a kettlebell and picking it up in that position. Your spine is designed to move in this way, so better to start trusting it rather than avoiding it.